So I'm gonna go over some post-op instructions with you so that way you know what to expect after your surgery. When you leave our office, your mouth is gonna be completely numb. You're gonna be biting on gauze, holding pressure on those areas to get your bleeding or oozing under control. Once you get home, you wanna take out those gauze and then get something to eat. I recommend something cool and soft to start out with. If we have anything warm in temperature, that's just gonna promote bleeding. So have, yogurt, applesauce, Jello, anything, that is cool. And then you can take pain medication. If you're taking pain medication on an empty stomach, you can feel really nauseous or like you're gonna throw up, and that is not fun after you've had mouth surgery. And so once you've eaten something, then you can replace those gauze. So we're gonna send you home with extra packets of gauze, and then you can just check those every hour. Once we know bleeding's under control, then you can take the gauze out and you don't need it anymore. And then swelling and bruising, that's all normal post-op healing. It's really important that first 24 hours to keep your head elevated and ice as much as possible. That will help decrease your swelling. So after we know your bleeding's under control, things are no longer numb, you can have a soft chew diet. So things that you can cut with a fork, scrambled eggs, pasta, pancakes. So don't feel like you're restricted to a liquid diet. If you are just eating liquids and soft foods, it's not gonna be comfortable to open your mouth. So pain medication, typically patients are utilizing that within the first 2-3 days. Then we want to move on to ibuprofen. If you feel like you're not achieving adequate relief with the pain medication, you can stagger your pain medication with ibuprofen up to 600 milligrams. We want to avoid taking any additional Tylenol because most of the pain medication we're prescribing contains Tylenol. So aside from the prescription pain medication we'll be giving you, we're also gonna give you a prescription mouth rinse. This is an antibacterial mouth rinse that will help keep everything nice and clean while you're healing. So we're gonna have you start that the day following the procedure, once we know your bleeding's under control. The day after your procedure, when you wake up, your mouth's gonna feel tight and sore. So you're gonna mostly focus on brushing the front kind of smile area, and then you're gonna be utilizing that mouth rinse to keep everything nice and clean. So that first day, you'll just gently swish, kind of rocking your head side to side and let it fall out into the sink. When we are over the risk of where dry socket can occur, then we can start utilizing a little irrigation syringe we're gonna send home with you in your post-op bag. Dry socket is where after the teeth are removed, it bleeds there, it forms a blood clot. And so that's acting like a little scab in your mouth. So we don't want to dislodge or disrupt that scab by sucking through a straw, spitting really hard, smoking, things like that can potentially dislodge or disrupt those blood clots, and that's what dry socket is. Some things to look out for while you're healing are infection. Signs of infection are going to be increase in swelling, typically asymmetric. Asymmetric swelling is where one side of your face is looking bigger than the other. So if we know we had both wisdom teeth out on the lower jaw and one seems to be increasing and the other one is not, then that might be signs that there's something going on that side. Increase in pain, swelling, foul taste in the mouth, pus, discharge, those are all signs that there's infection. At Greenlake Oral and Facial Surgery, it's really important to us that you feel supported after you've had your wisdom teeth removed. So there is somebody on call on the weekends or after hours that you can call us and we can address any of your questions or concerns.